All right, we are back inside the 3-Point Conversion Sports Lounge. And what do you have here? What do we have here? We have Dr. Fowler in the building. What's going on?
Hey.
I miss you guys. Had to come in person this time.
Hey, man, how's it going?
Doing well. How you guys been?
I'm great.
Good,
I'm great.
good.
This is Dr. Fowler the third, Donnie Fowler the third, and he's an orthopedic for OrthoAtlanta. And he's here for our Ask a Doc segment. This is where we get a chance to figure out about these injuries, why it happens, what is the cause, how it's going to impact the players or team. So and then he shares his sports knowledge as well. Surprised he hadn't said Duke yet. So, but anyway,
Dookie got drafted.
Daniel Jones.
there you go. And he's proud of Daniel Jones. So you know he's a Duke fan when he's proud of Daniel Jones. No, I'm just kidding. All right. So first, man, you know, this Milwaukee-Boston series is taking a turn. Milwaukee's up 2-1. But they're doing it without Malcolm Brogdon. And he's missed 64 games, you know, without – and they say he's possibly returned for Game 4. He's been out for this plantar – how you say it? I don't even say it.
Fasciitis.
Fasciitis.
I always do the same.
Yeah, fasciitis. I can't never get that first fasciitis, and because I'm looking at it trying to read it. That's what throw me off every time.
Yeah, trying to say it how it
Read
look.
it, yeah. But anyway, this plantar fasciitis. First of all, why did it take 64 games? And then on top of that, will he be good enough to be an impact for Game 4?
Yeah, a lot of people have had plantar fasciitis. It's that kind of bottom of your heel foot pain when you first step out of bed. Feels like someone's stabbing you in the bottom of the foot. So it kind of, you think about it and all these other crazy injuries, and you're like, man, it's foot pain. Are you serious? But it really can limit you, especially in a sport like basketball with all the constant running, jumping, change of direction. So I think that's why, if it was an everyday you or me kind of thing, you'd be able to live life. But to compete on the NBA level, yeah, you really got to let it settle down. And some people, that takes 6 months. Obviously, he's coming along a little quicker than that, and hoping to see him out there. To your second point, I think he's going to be limited when they first bring him back. So I think he can contribute, but I don't necessarily think he's going to be a kind of game changer. But he'll certainly give them more depth.
So like 10, 15 minutes a game.
Yeah, I think
like
they'll start slow. Apparently he's looked okay at shoot around and some of the other stuff where they've seen him out moving around, but obviously they're not going to push him too hard.
Now, recently we saw Corey Kluber. He was placed on the IL with a fractured arm after getting hit by a 102-mile-per-hour comeback. How long do you expect him to be out, and how does it affect his arm?
Yeah, so most people saw it's his pitching arm. It hit him kind of on the outer pinky side of the forearm, so he broke that ulna bone, which is one of the two forearm bones. And I guess the good news is it's non-displaced. It doesn't need surgery, but a bone still takes somewhere between 4 to 6 weeks to fully heal. Now, I'm sure they'll be hitting him with growth factors and bone stimulators and everything under the sun to try to get that thing to heal as quickly as humanly possible. But he'll be out at least a month. Just from the healing standpoint, and then I figure it's going to be at least a couple weeks getting back into actually throwing with it. Probably have to make some minor league kind of rehab starts before he actually comes back up with the big league team.
So probably you talking like 2 months probably before you can get back.
Yeah, you said it so casual too. I thought it would be like most of the year or something like that.
I'd say I'd say maybe 2 months would be a good guesstimate of trying to see him back throwing at that point.
So my question is, if he got hit in the off arm,
he probably would be out there.
Could
still.
he pitch? Yeah,
he'd still be probably uncomfortable, but they could probably put him in a brace or something to kind of protect it while he pitched. So yeah, he might be able, or he might have been able to try to do it if it hit his left arm, not his right arm.
Okay. And rookie minicamp for the NFL, it began this weekend for certain teams. Now, mini camps, they tell you usually don't go hard, but these rookies, they're trying to win a spot, and they're going to be going 150 miles per hour and giving it all they got. or they have, I should say, all they got is a sports term, but all they have, sounds like a sport. But anyway, do you think that's wise, knowing that if some of these players hadn't went out and worked out, or not worked out, but ran like that and went full speed, you think that can cause injuries?
I mean, obviously anything's possible. I don't think there's been a lot of history of of injuries coming out of rookie minicamp. Certainly they're not, putting on the full pads or anything like that. I actually think it's a lot of the undrafted guys that, not as big of names that are probably out there working harder, trying to prove their merit. The guys that got drafted in the first 6 rounds or so that feel more comfortable about that spot. I think they're more keyed in on trying to, learn the playbook, kind of get a sense of what the team concept is and try to start putting it all together. But certainly athletes are competitors. So when they get out there, it's not like they're just going to, jog around. They're still going to get after it, like you said. So,
and I know that I can ask you this during training camp, but I want to know, how do you feel about the two-a-days and not being there anymore? Do you agree with that? Knowing your field, but do you agree with the no two-a-days anymore?
Yeah. I mean, I think it's a double-edged sword. I think there's advantages and disadvantages both sides. Obviously, they're trying to keep the players fresh and healthy because it is a long season, but at the same time, the 2 days do help you get into better conditioning to kind of survive throughout the season. So when you're scaling back the number of hours and the number of practices you're allowed to have, these guys, even if they're doing their own thing on the side, still probably aren't in quite the same shape they were back when they're doing 2-a-days. So I think the 2-a-days were probably more beneficial as long as you did them responsibly. But
thank you. That's what I always thought. All right, so last question. Who is your top 5 scorers of your lifetime? Top 5 scorers. We were talking about KD.
Okay.
This is the theme of the show. Who are your top 5 scorers?
NBA.
That you watch, in your lifetime.
NBA that I've watched.
I know you don't have that much time.
No. I mean, I'm sure I'll hit obvious ones. Scores. I'd go Jordan. I'd go Kobe. I'd go Iverson. God, I would probably say. I guess I'd put KD there. I'd put KD there now, and I think I heard it when I came in. I think you might have to put T-Mac in the conversation too. But.
Okay, respectable.
Yeah, that top 4 was pretty much around
everybody
the board.
went.
The 4 was around the board.
Yeah, right. Okay, we respect that. Well, Doc, we appreciate you for coming on, man.
Always a pleasure.
That's it. Like I said, you get that good stuff when Dr. Donnie Fowler comes in and, give us that insight on injuries and the impact. So make sure you keep it locked. We will be back with baseball talk. We'll be right back.
Have a sports injury? Need to see an orthopedic doctor? OrthoAtlanta is one of Metro Atlanta's largest orthopedic and sports medicine practices, providing orthopedic and sports medicine care for the whole family. With 37 physicians and 14 offices, the practice provides the highest level of care for injury of muscles, joints, bones, and spine. OrthoAtlanta offers convenient access to a full range of musculoskeletal surgeons and specialists. OrthoAtlanta also offers on-site physical therapy, pain management care, MRI imaging, and workers' compensation care. The OrthoAtlanta surgery centers in Austell and Fayetteville provide cost-effective, same-day surgical procedures in an accredited outpatient center. Hip, knee, shoulder, back pain? OrthoAtlanta has you covered with specialists in all areas. Same-day appointments, orthopedic care for the whole family. OrthoAtlanta, Atlanta's choice for orthopedic and sports medicine care. Learn more at www.orthoatlanta.com.